You're listening to Nutrition Matters Podcast with Paige Smathers, registered dietitian nutritionist. Hey everyone, it's Paige, your favorite nutrition podcaster and dietitian. Nutrition Matters Podcast explores what really matters in nutrition and health with a sensitive and realistic approach. This podcast relies on the support of listeners like you and needs donations to keep this project running. To help support the podcast, please consider making a donation at pagesmothersrd.com/podcast. If you find this episode interesting, engaging, or helpful in your life, please consider donating, sharing with friends and family, and leaving a review on iTunes. You can leave a review about this podcast straight from your podcast app. Search Nutrition Matters Podcast, click Reviews, and then write a review. You can also find me on Instagram and Facebook at Paige Smathers RD if you'd like to have a little more food for thought. Thank you for listening. Hi everyone, welcome back to Nutrition Matters Podcast. My name is Paige Smathers and I'm your host. And I'm so excited to bring you this episode all about PCOS and how you really don't need to torture yourself with diets to treat it, to manage it, and to live a happy, healthy life with a diagnosis of PCOS. If you don't have PCOS, I still think you should listen because there's so many kernels of amazing truths in what Julie talks about in this episode. And I think you're going to get a lot out of it no matter who you are and what your background is. So stay tuned. So I invited Julie Duffy Dillon to come on this episode, who is a registered dietitian nutritionist in private practice. And I've had her on the podcast before where we talked about recognizing disordered eating in a thin obsessed world. Julie is the host of the Love Food podcast. And, we're good friends because we love to talk about podcasting and our mutual interests in terms of not dieting. So we bring you this conversation in this very same context of, how do you take good care of yourself with a diagnosis of PCOS while avoiding some of those common pitfalls that people recommend really restrictive diets, which only really exacerbate the issues. So before we get into that, I just wanted to say that if you enjoy this podcast and if you like what you hear, you can do a few things to help give back. One is to leave a review on iTunes, and I love it when I see those reviews come through. So thank you to those of you who have already done that. Another one is if you'd like to continue the conversation outside of the show with some listeners, we have a Facebook group, and you're welcome to check that out. It's called Nutrition Matters Podcast Study Group, and we'd love to see you there. Also, if you like what you hear and you want to learn a little bit more about the how-to and the really practical application of not dieting but living a healthy, happy life, you're more than welcome to join us over in my online course where you can check out more details on my website, pagesmothersrd.com/course. This course is intended to help you move away from chronic dieting and find a way to hone in on a healthy place with your food and with your sleep and with your self-care, and also with your mindset towards food. And we have a lot of fun in the course, and so I'd encourage you to check it out. And with that, let's go ahead and get on and talk with Julie Duffy Dillon all about her deep dive into the world of PCOS. All right, well, Julie Duffy Dillon, welcome back to Nutrition Matters Podcast.
Thank you so much, Paige. I am so excited to be here and honored to be a guest on your show. So thank you.
Yeah, you're welcome. And thank you for your time and expertise on such an important topic, because this is of all the things, all the diagnoses that walk through my office door, this particular one, PCOS, tends to just kind of have some really common threads. And one of them is just utter confusion. I think that there's so much information out there that's not necessarily good information, a lot of holes in the research, a lot of sort of questions about what we really know and what we don't know about this condition. And the women who suffer with it often are just feeling really, really hopeless and really confused. So that's why I wanted to bring you on, is just to talk about this, to provide hopefully a resource for people to kind of get introduced to a different idea and a different view on how to approach PCOS. Does that sound like a good sort of foundation of what we're doing here?
Yes, and I totally can appreciate that confusion because I feel like as a provider, I was really confused too. Like my clients would come in with PCOS and I'm like, "Ugh, I'm not really sure what I should be doing here because I feel like it's something that is so under researched and is affected by lots of different systems in our world that are not really helping women with PCOS. So I'm excited to dive in because I'm hoping it'll provide listeners who are affected by PCOS and maybe people in their family, but also other providers, other therapists or dietitians or medical providers who work with people with PCOS. I hope it gives them some food for thought, like you always say, and just something to think about. Like, yeah, me too.
I just love them.
But anyway, yeah, I hope it gives them just another kind of direction to go so then they feel less confused and more helpful.
Definitely, like helping without harming, right? And that's always what we're trying to do. And just as a little side note, you've been on the podcast before. We talked about how to recognize disordered eating in a thin, obsessed world. And my listeners will probably already know this, but I wanted to just reiterate that I've gone through and I've deleted some of those first few episodes. And that one that we did was one of them that I did delete, but I'm going to be republishing. So if you're listening to this anytime in the future, you might be thinking like, wait, where's her other episode? But it'll come soon. It'll come in the next few months where I'll republish it. So that was a really fun conversation too. And super, super important. So, okay. So PCOS, I think I want to define PCOS, but before we do that, I want to talk about how when you kind of come to this idea that diets just don't work, and maybe you're a provider, or maybe you're not someone who is in the medical field, but maybe you're affected by dieting in one way or another, which we all are, and you kind of say, diets don't work, I don't want to do that. Next thing you know, you've gotten like slapped upside the head with this diagnosis of PCOS, and the recommendation from your provider is, okay, go on this really strict diet. Or you are a provider and you're like, okay, I don't believe in dieting, but this is all I've ever learned about how to treat PCOS is this really strict diet. So that can cause some cognitive dissonance, right? Where you're like, wait a minute, how does PCOS fit into this non-dieting paradigm? So that's sort of what I see us trying to fill in the gaps with today, plus just kind of provide some good basic information because, like I mentioned earlier, there is just so much out there on the internet about what to do and what not to do with PCOS, and a lot of that information just contradicts themselves and causes a lot of confusion. So that's kind of where I'm coming from.
I'm ready.
Okay, perfect. So I think we've talked about this acronym of PCOS, and some people are probably like, "Okay, can you please tell me what the heck that stands for?" So go ahead and let's talk about what PCOS is, and we'll kind of bounce ideas off of each other with this.
Yeah, I'm so happy to be the one to share this, especially if someone's never heard of it or is new to PCOS, because there is a lot of really bogus stuff out there. And this past summer, I have a grad student, like a nutrition intern that's been working with me. And she's a woman that's also has PCOS. And we've been really digging through the research and putting together a resource for women who, if they want to know about PCOS or if they have it. And it's cool because I've learned more about it. And, PCOS it stands for polycystic ovarian syndrome. And it basically is just a set of symptoms that result from a hormonal imbalance. And honestly, it's a condition that's a diagnosis of exclusion, which is a really horrible thing to have because there's no exact thing. Like if, I don't know, if you have diabetes or if you have, I don't know, cancer, there's these exact markers they can find. And with PCOS, it's just well, we know you don't have this and this and this, so you have this. And it's really, it's really, it's just really uncertain for so many people. People oftentimes will say, well, I'm not really sure if I have it, even though they said I have it, because it just is weird. And basically, it's an endocrine disorder, and it's characterized by high levels of androgens, which are also called sex hormones. So especially testosterone. That's the one in particular that gets the most press with PCOS in women. And all of us, whether we have this condition or not, we all have testosterone floating in our body. And women with PCOS just have more than women without PCOS. And they also experience some kind of irregularity with their menstrual cycle, whether they have a missed period or it's irregular or painful or they just never ovulate. And so they never have a cycle. And they've changed over the years how to diagnose PCOS. And a lot of times this is important, especially lately, because people will have a lot of the symptoms of PCOS and then go to the doctor and get an ultrasound done. And the doctor will not find these cysts. I'm kind of using air quotes right now that you can't see, these cysts in their ovaries. And so like, oh no, you don't have it because you don't have the multiple cysts on the ovaries. But really a woman can have polycystic ovarian syndrome and never have these really follicles on their ovaries.
So my understanding is that you need to have 2 out of the 3
Yes.
symptoms,
So
right?
one of them is, yes. And
Okay.
so one of them is these multiple cysts or really multiple follicles. But the other 2 is just some kind of irregularity with your period or absence of ovulation. And the other one is high levels of androgens or just a sign of high androgens like excess body hair, facial hair, or hair loss on the head. So they don't even have to have a blood level drawn. If they just have symptoms of it, that's enough.
Right.
And so, a lot of times people will be like, well, I just never had cysts on my ovaries, so I don't think I have it. I'm like, no, you have it. So,
and something to clarify in case people haven't caught on, this is only a problem in women, right? So we're talking about polycystic ovarian syndrome. And so we're talking about...
Well, I mean, yes and no, because there's been some people who are finding something similar with men. So
is that right?
Yeah, but I'm not prepared to talk about it.
Okay.
But when I go to conferences that are talking about this, it's kind of the buzz. But there's something similar that men experience. And
interesting. I did not know that.
Yeah.
And gender isn't as binary as we think anyway, right? I mean,
exactly. I mean, that's a good point too. And, something that's kind of a side note, but I think is important is a lot of times people will say, well, if I have high testosterone, does that mean I'm less of a woman? Or does that mean that my sexual preference will change? And those are all no, it doesn't affect those kinds of things. And, but yeah, if men end up having something similar, then there's going to be more research dollars put into it because the feminist in me is like, well, at least they're going to start researching it.
Yeah,
so that could be good for the rest of us.
That's fascinating, Julie. I had no idea that there's sort of like a cousin to this in men, perhaps. Interesting.
Yeah.
Okay.
Well, and the thing about PCOS that we know is that it's genetic and environmental. So it's passed down through families. I talk to a lot of people. This is just clinical observation, but most of the people I talk to, they notice a pattern on the male side of their family. So that's why I'm like, there's probably is one for men too, just because there's a genetic side to it. And there's also this environmental connection because of just how food has changed over the years. And so people with PCOS have a susceptibility that's different than other people to some environmental changes that are kind of interesting. But in the end, to put this all in like a nutshell here is that PCOS basically with its genetic connections, it starts in the brain and specifically in the hypothalamus. And that's where the hormones are made that end up getting disrupted with this condition. And it ends up affecting like literally every part of a woman's body because the hypothalamus is where our mood center is. So mood disorders are really common, like anxiety, depression, bipolar disorder, even ADHD or ADD or just some kind of attention deficit type of differences are really common with PCOS. And then also because of this hypothalamus being like the hub of PCOS, it ends up affecting insulin is a hormone that ends up getting out of whack, basically. So it affects how a woman digests the food that she eats. So it affects, for some women, it ends up affecting what their body looks like. And it affects like their energy levels or lack thereof. And, so their whole body ends up being affected by it. And most women, what happens is that if they get diagnosed with it, they're basically given a pamphlet or they're just told, like, as the doctor's walking out, oh, yeah, you have this PCOS thing. I just come back when you're trying to get pregnant. They just kind of brush it under the rug and they don't really say anything. And
or they say, here's a very restrictive amount of carbohydrates you're allowed to eat in a day.
Well, yeah. I don't like when I hear that either. Because basically the common practice, if you Google it or even WebMD it, the primary treatment for PCOS is weight loss. And when I started seeing people with it, I really didn't know what to do. And I also was starting to really reject diets. But when I looked through all my training in PCOS, which was really small at that point, all I knew to do was to help them lose weight. And so I did that. And not only did it feel crummy because it was this ethical kind of dilemma I was experiencing, but it didn't help anybody. People's symptoms just got worse and they felt worse about themselves. So it made me really look at some different ways to treat it. And luckily there was a woman who had this network called Insist, and she developed this multidisciplinary network and training. Her name is Monica Woolsey, and she's a dietitian that basically retired from working with PCOS at this point, but she was really into the endocrine system and the research behind it. And not only was she a dietitian, but she was also an exercise physiologist. So she just was really savvy. And this was about 10 years ago that I got the training. And what I found is that by treating like the symptoms and also pursuing weight loss made it so much worse. And there's ways to get to the core, like to get to the hypothalamus, basically. You can't cure PCOS, but it can definitely heal what's going on from the PCOS. So then long term, a woman can make peace with food. She doesn't have to fight her body. She doesn't have to pursue weight loss or cut out carbs. Like there's ways you can do it that end up helping them actually feel better long term without like the torture. So yeah, I mean, that's one of my big messages for women is if you have this, don't believe the hype. Like you could still, continue on your journey for food peace, because we have so many other options. And I think things like weight stigma, unfortunately, have affected women with PCOS more than anyone else, because it's just slapped on there like, oh, they just need to lose weight and that'll treat it. Or even some people are told like, well, you gained weight and that caused it, which that's totally false. No one caused their PCOS.
You can be any body size and have PCOS. That's an important thing to know.
Oh, yes. Oh, for sure. I mean, I've seen people in every shape and size, every ethnicity. I had more than one. I've had a number of clients that have like lighter skin and lighter hair color, and their doctors will be like, no, it's only people with dark hair.
Oh, what?
Really? I'm like, well, she could have dyed her hair, first of all.
Right.
And then,
oh, that's funny.
But no, I mean, yeah, it's
Julie,
in everybody.
Let's talk about, just to paint the picture, because I'm kind of imagining, I'm hoping that there are providers listening. And sometimes I think just with the nature of medical care, it can be really hard to have enough time to sit down and really hear someone's story about what it's like to live with PCOS. Like let's highlight that. Let's talk about what we've heard our clients say, and especially you with all the deep dive you've done into this world. I just really want to paint the picture of what life with PCOS looks like for some, and it's going to look different for every person. But what do you want to say about that?
Oh my gosh. Yeah, everyone's story is different, but there are some tremendous like patterns and themes. And I love when women with PCOS get together and talk, because then they're like, oh my gosh, I'm not the only one that does this. And, when a woman wakes up with PCOS every day, she is usually sleep deprived, because sleep disorders are super common. And so usually didn't get a very good night's sleep, and already feeling kind of a weird kind of craving, but also not really having any interest in eating because of the way insulin levels are already going to be messed up when they're waking up. So for a lot of women with PCOS, they don't usually end up eating until later in the day, because it's just how their circadian rhythms for eating have ended up. And so because they're so sleep deprived, so many end up relying on like coffee, because they're like, I need to get work done, or I have kids to take care of today, so I need to do this. And it ends up happening then too, is there's like, when they walk out into the world, they feeling really unfeminine because of lots of hair on their body, especially on their face, and losing hair on their head, feeling less feminine because of that. And then for not everyone, but I've seen ranges of 60 to 70% of women with PCOS are women of size. And so carrying a lot of weight around their midsection, which for some women, not all of them, but for some women, that's a symptom, just a symptom that their insulin levels are high. It's not something that they caused. And And so they're walking into the world where they feel like defeated because they've probably tried and tried and tried to change their weight. And what they end up trying to do are a lot of fixes that they're told to do, like cut out carbohydrates or cut their calories lower. And what ends up happening to them is it ends up making cravings really, really, like to the cellular level, unbearable. And so when a woman gets hit with a craving with PCOS, and it usually happens around like 2, 3, 4 o'clock in the afternoon, and then again later at night, it's not just like how you and I will be like, that brownie looks good. It's more like you have to eat that. Like it's like a cellular level, like their biology is telling them they have to eat it.
We can talk about like the reason why with that is the elevated insulin levels or the hyperinsulinemia.
Yes.
I have a way of explaining this, but it's not very scientific, but it helps people understand it. Do you want me to roll with it and you can correct me?
Okay. No, I'm sure it's right.
Okay. I mean, it's the general idea. It's not accurate on a scientific level. But so with a woman who doesn't have PCOS, let's say she eats the equivalent of like 10 glucoses. This is how I explain it. You eat 10 glucoses, which is just carbohydrate broken down into its form that feeds cells. And the average woman might use 6 of those glucoses to feed the cells of the body and then keep 4 of it in the bloodstream to kind of keep the blood sugar levels where they should be, because you need blood sugar. You need sugar in your blood at a continuous level. Like you don't want to have
or you'd
zero.
Be brain dead.
Yeah, it wouldn't be good. But a woman with PCOS and that hyperinsulinemia, what's going on is the insulin is what brings the glucose into the cells. And so when she eats 10 glucoses, instead of giving 6 to the cells, she might give 8 or 9 to the cells and then only have like 1 left over for her blood. And then her body detects, oh no, blood sugar is low. I must find something with sugar in it to eat. And it's because that elevated insulin level got way too much glucose into the cells, not enough still in the blood. So what that does is it really leads to an elevated feeling of, I have to find sugar and I need it now. And if I don't get it, I might die. And that's really kind of how it feels. What do you think?
Yeah,
did I do okay?
Yeah. And the thing that is really, one of the hardest parts of specializing in PCOS is that the research is just not really there yet for us to understand exactly what's going on. But yeah, I mean, one of the things that I notice is, or what I often talk about is how insulin is like the doorman for the cell, and it's trying to open the cell door. And one part of research that's emerging that's super exciting is that the doorbell to the cell may be broken in PCOS. And usually when the doorbell of the cell is broken, the body sends a signal. And these secondary messengers, if you can picture these little messengers coming down to fix it, people without PCOS, it fixes the doorbell and then the insulin can work. Well, these secondary messengers are either defective or deficient. There's something going on in that system. And so then the body just, all it knows to do is to send more insulin to like help open the door more. So there's lots more blood sugar shifting around, and there's a lot more insulin. And I think a lot of providers think of this insulin conversation just like how we talk about with diabetes. And, there's some similarities because we talk about insulin, but the hyperinsulinemia with PCOS is so much higher. And that leads to symptoms that are different. And it leads to also like the insulin levels need to be treated before you do anything else. And especially, I know diets don't work. And if we lived in a society where someone invented one that actually did, like I'm not going to hold my breath on that. But if there was one that was invented, it wouldn't work because the insulin levels are just so high. And insulin is a growth hormone. Like it just would make the body like keep going through this process until insulin went down. And so there are no diets that work anyway, so it's kind of a moot point. But when someone tells someone with PCOS, well, you need to lose weight. Well, no, you need to help her lower her insulin levels. That's what the first thing you need to help her do, whether it's through medication or through supplements. And that's where I always go first with people. It's like, let's talk to your doctor about medication or supplements. And
because if it doesn't matter how great you're eating and sleeping and taking care of yourself, if your insulin levels are elevated, you are not going to be feeling well, functioning well, right?
Well, and you can search online. There's people who do it, but it's just like there are people who like are able to lose weight, but they're not the typical, like you can't use that as the outcome for everyone. And also like there's anorexia. Yeah, there's people who are good at that stuff, but that's called anorexia, you know, and I think one of the big parts of PCOS that is really frustrating to me is basically women with PCOS are told to torture their body and practice anorexia. You know, we would call it anorexia in a woman with a smaller body for sure, but women in a larger body with PCOS, they're made to do it. I think there's like this disconnect on why is it okay for them? You know, why they have to torture themselves, and we call it pathological in someone else. And it's not the same. It's a really big problem, and it's part of weight stigma. You know, it's just you got to get rid of it however you can. But yeah, so if there's anyone's a provider for people with PCOS, understanding how the hyperinsulinemia is so much different and so much more biologically involved, and it literally will drain the woman's body. So if a woman is told she needs to be more active with PCOS, because being more active, you know, as humans, I think we're just meant to move, and I don't think we should do like no pain, no gain stuff, but like joyful stuff, things that feel good. And I would love for women to find something that was and pleasurable for them and to move their body. But a woman with PCOS that has untreated insulin levels, it's like carrying around a bag of rocks. You know, they just can't, it's not the same, you know? So somebody were like, yeah, it just feels like dead weight that I'm moving and I'm trying to move my body. And so that's why I'm like, just help them lower their insulin levels. And I unfortunately hear a lot of providers who like won't provide fertility treatment or even help them treat insulin levels until they lose weight. And that is like disgusting to me. I'm like, that's super discriminatory, you know? And just knowing all of this physiology, I hope that convinces some people just to do it a little differently.
I love it. So to continue on with the idea of kind of painting the picture, one thing we alluded to but didn't say outright is that there are immense and very intense cravings associated with PCOS. I mean, you actually you did say that. You said that outright. So she might go throughout her day feeling just compelled on just a cellular level toward the sugary, simple carbohydrate type of food, or just maybe food in general. And then on a mental health level, what that does to a person is it makes them feel like, gosh, what is wrong with me? Like, why am I such a loser? I mean, they might say these things. I'm not calling these people, losers. No, but that might go through your head. Like, gosh, I just have no willpower. I clearly need to make more rules. I continue to fail. You could go down that shame spiral pretty intensely. Meanwhile, they're making more rules saying, okay, tomorrow I'm recommitting. I'm not going to do that. And you can see how this could be a recipe for an eating disorder, right? Where I feel like a failure. I keep failing, and then I make more rules, and then I keep failing, and then I just give up and binge on all the foods. And, then I recommit and say, okay, I'm going to be good, And
isn't that so exhausting to think about?
Exhausting, yeah.
So exhausting. There's so much shame and blame because, again, so many people think they caused this condition because of their weight, and then they have these cravings, and so when they give in, because they're really just doing what their body's telling them to do, there's like immediately a level of shame and, oh, geez, how did I mess it all up? And so what I end up hearing from people that I talk to is that they feel like they're constantly bouncing between dieting and not dieting, and or restricting and binging, and it's exhausting in itself. But then that's just on the outside, but inside their body, they're feeling so much shame and blaming themselves for all of it, which then ends up making mentally this just even like a deeper like rabbit hole in a sense. And then like from a cellular level, that also like putting that all together, it ends up making their body more stressed. So then it makes all those other hormones even more out of whack.
Right. And then it makes it harder to sleep. And then it makes it harder to get out of bed because you're kind of depressed and don't want to start the day. Right. So there's all these angles that you get hit with with pressure and stress and anxiety around this. And that, you know, if we're really talking about health, that's not healthy for you, you know?
No. And I feel like there's so many people who talk about, you know, you got to be, oh gosh, what is it? Like more responsible. And so maybe feeling a little ashamed will help with the responsibility. And I'm like, no, those are like diametrically opposed. You know, like
shame does not really lead to action. It just leads to like
it doesn't. It doesn't like exactly. It doesn't lead to like responsibility. And if you know, people are thinking like a drill sergeant, like shame is not going to help with that. And I mean, that's something we've seen in research over and over again. We know that shame doesn't promote health, but women with PCOS, because of the weight that's associated with it, I feel like are stuck because that's all that science is telling them is just, well, just keep trying harder. Just try harder. Like there's a couple women that I know with PCOS who are amazing athletes. And a little side note, because of the high circulating testosterone, women with PCOS end up having more dense muscles. And you'd be surprised how many women with PCOS were like really amazing high school and college athletes. And, but I've worked with a few who, you know, experienced the PCOS and were really good college athletes. And then it just got to the point where their body was just so depleted from the eating disorder behaviors and the PCOS like recommendations that their sport was no longer able to be done. But then as we worked together and they were repleting levels and healing their relationship with food, they got back to their sport. And there's a couple that I've worked with that were like marathon runners and things like that. And running like sub 4-hour marathons, okay, which is really fast. Like
that's amazing.
They run it like, yeah. And doctors are still telling them, well, you just need to exercise more. And have you thought about cutting out carbs? And
for crying out loud.
That's like one of the worst things you could tell an endurance athlete or anyone really. But yeah, so just keep pushing it in that same direction, even though like we really need to know what a person is doing. And honestly, I think part of the weight stigma that affects women with PCOS is that I don't think a lot of healthcare providers, and I'm guilty of this too, especially when I was in the beginning of my career, where I don't think I believed people when they said they ate very little and they weighed more. I think I just assumed they weren't telling me everything. And I can remember being told that when I was getting trained, like, oh yeah, people are going to tell you they're only eating this much, but they're really eating this much. And so, but after like 20 or 30 women with PCOS were like, look, I'm only eating blank amount of calories, which was really, really low, and I'm exercising this amount. You know, they can't all be lying, you know, like right. There has to be something to this. And honestly, that's the common story is like women with PCOS, so many of them, especially if they've been trying for a really long time to treat it, they're eating dangerously low amounts of food, cutting out all food, like certain food groups or like certain macronutrients, and their bodies are sicker. They're not healthier from it.
Okay, so Julie, I like to kind of anticipate what my listeners might be thinking, and I just want to take a minute to anticipate someone who might be listening saying, okay, well, I was diagnosed with PCOS, and I cut down on blank amount of carbohydrates, and I just feel so much better. I lost all this weight, and I'm just like, my life has never been better. My mood, I'm, whatever, right? On and on and on. Like, okay, these crazy dietitians who are semi like anti-establishment of like, in terms of like the diet as the treatment, as the establishment, and or maybe a provider saying like, wait, how can this be that we've gotten this so wrong in the medical community? Maybe these guys are just crazy. What would you say to that?
Well, personal experience is personal experience. And so there's always going to be someone that can cut out something and it works for them. But all I know is the research. And so far, the research with PCOS and cutting out, I don't know how particular you are about saying certain nutrients, but let me know if you don't want to go there. Okay.
That's all right.
Okay.
Yeah.
Okay, good. So in particular, it's often recommended that women with PCOS cut out carbohydrates or sugar or both, and either completely out or, really, really dangerously low. And when the research that backs that, when you peel through the layers of it, the research was only 6 weeks long or 12 weeks long, which I know lots of people who can do some pretty quick fix diets for that length of time. And yes, women will often say they feel so much better when they do it for 6 weeks or 12 weeks. And there's something about that 2 to 3 month mark where when research continues to go with that with PCOS, cutting out carbs and sugars, and also things like gluten. That was another one. Women often say that they felt so much better. But at the 2 to 3 month mark, for the majority, it stops working. Like they no longer feel as energized. And what Monica Woolsey, the woman behind Insist and did all that training, I did the training with, what she said was basically cutting out those things was like a Band-Aid. And so in the short term, it changed insulin levels because it was like a stressor on the body. And so for short term, it did it. But when you look at it long term, it's not going to where PCOS starts. And honestly, when I work with people one-on-one and do any kind of training, the last thing we talk about is carbohydrates. I talk about proteins, I talk about fats and movement, and then carbohydrates, because when you cut out carbohydrates, it doesn't lead to lasting change. And when a person is actually like no longer dieting and eating enough and feeling okay in their skin, maybe they don't love their body, but like really trying to work towards respecting it and giving it enough food. And then we're working on bringing down insulin levels, with medication or supplements or something. Once we go through all those steps, you don't need to do anything with the carbs. Like they end up just being where they need to be. And it's different for everybody. Like some people just end up craving less, or some people eat an amount that's like what I guess textbook and dietitian trainings, 40 to 60% of your calories. And it just ends up being really individual. And so right. I think focusing on those, like cutting out certain things will not work long term.
Okay.
For most people.
Yeah.
For most
and just
people.
a follow-up
There's going to be that random one.
Right. Yeah. And if, you know what? And if you are that random one, nobody's telling you to stop. I mean, do your thing.
Because I really feel like, because I feel like with women with PCOS, you are the expert of your body. Yep. Like anybody else, you know what's best. And so you are the expert. And I want to help you to feel like you are the expert again. And so if that works for you, that works for you. Yeah, and absolutely. As long as it's sustainable, I could care less, because that means you're feeling better and you're more yourself. And so less distracted by everything else.
But know that you're definitely the exception if that's you. One follow-up question is, what about the person listening who's saying, PCOS runs in my family. I haven't been diagnosed with it, but I'm concerned I'll get it. So I'll just go ahead and follow this diet prescribed by an endocrinologist, whatever, as a preventative measure.
Well, it's genetic. So it's kind of like any of those other genetic things. We can do everything that's quote unquote right. And because of the chronic side of PCOS, it's always changing, that eventually the symptoms would come out. And we don't know exactly how to treat it in that way to prevent it. And a lot of the nutrition recommendations that I know to help most of the people I work with, they're not necessarily going to harm someone else, but yet it would be really important, I think, to know if you have it or not. And also to know that there's really no way you could cause it. Like, it's not like you could eat a Snickers bar and then the next day you have it. Same thing with like diabetes, it's not like you can't do anything to make it happen. Yeah. So, I mean, it's so hard for me to be like, just don't worry about it. But
well,
I don't have PCOS in my family, so it's hard to do that.
Your point is it can happen. That's not really evidence-based.
Yeah. And also listen to your body. When it tells you something, it can let you know. And I feel like women with PCOS, they don't feel like they're the expert of their body anymore, because they feel like their body has failed them. And as much as I, in my privileged health, I mean, I don't have PCOS, but what I've been able to gather over the years is that I think women with PCOS, their body just speaks a different language than the rest of us. And so if you can look, or if you just notice certain things, like if you notice a mood change or craving change, or energy level change, and if you can lean into it and wonder why it's there, I feel like that's a really great way to know if you, in fact, are starting to experience the beginning signs of PCOS. And I teach that type of stuff, though, to the women with PCOS that I work with. Is like when you hear those symptoms, it's really important to not ignore them or run away from them. It's really to say hello to them, because that's the way it's trying to talk to you about your needs and what your body needs.
Love it. Yeah, that's great. So Julie, let's talk about, I know it's very hard to talk about particular interventions one might take, but however, if you feel comfortable kind of broadly talking about what are some steps someone with PCOS can take to kind of start navigating this process, what do you feel comfortable sharing with that?
Oh, I can share a lot for sure. And some of the things I'll share, I have a free roadmap I can tell your listeners about. It's a free download. It's
awesome.
If they go to PCOSandFoodPeace.com, I have your first 3 steps toward food peace with PCOS. And one of them is really just getting that scale out of your house, smash it to smithereens, or give it to a friend to hold on to, but stop using the scale as a measure of progress, because that's just not going to be something that is going to end up working long-term for most people. And it ends up making the body have less energy coming in to help with healing all the hormonal imbalance. It basically causes a lot of inflammation in a woman's body with PCOS. And so the body actually needs enough calories to fight that system. And so if a person is trying to lose weight and cutting calories or cutting whatever, it ends up making this chronic inflammation worse, not better.
Yeah, and so that's scary. That can be so scary and so hard. So we need to acknowledge that that's like definitely not an easy thing for someone to do. No. But I think that is a really great first step. Just kind of like decouple your health from that scale.
Yeah, and you're right. I totally agree. It's like I said it like I was going out to get a loaf of bread.
Oh,
or something.
No, you were fine with how you said it. I just was thinking like, wow, someone listening might be like, whoa, that is hard to do.
No, it's hard. And what I often will do, I do a lot of bartering in my office. So I'm like, well, if you're still wanting to lose weight, I'm wondering if I can persuade you to put the pursuit of weight loss on the back burner for just 3 to 6 months. Because what I have found is,
yes.
Yeah. Oh, yeah. Yeah. It's okay. And the wanting to lose weight, that can still be there. It's just the pursuit of it, And so
hold on. We need to talk about that. That's so important. That's so important. And I think that's not something we talk about enough in this world. I think we're so like, no, I'm anti-diet. Boom. We just don't even think about weight loss. But I think what happens sometimes is we alienate people who are like, well, wait a minute. I do want to lose weight. I do want to lose weight. And
it's so easy for you and me to say we were not women of size,
Yeah.
So I'm like, of course I can be this anti-diet rebel and I can eat a cheeseburger and nobody's going to bat an eyelash. But the one thing I know is that there's no diets that work. And I wish our world was more accepting of diverse body sizes, because
me too.
There are always going to be fat people. So
and it would make everyone's lives better. Everyone.
Yes, everyone. And if we're talking about PCOS, like I don't care what size you are with PCOS. If weight stigma was no longer a part of our culture and our society, then it would tremendously improve your health outcomes, because all of the research money is going into losing weight with PCOS.
Well, and
it's not fixing anything.
The fear of fat is affecting your health, right?
Yeah.
Like no matter who you are. And I'm not, I'm trying to include everyone in this, and I'm not trying to say, oh, it's just it makes the thin people's lives better. I'm not trying to always have that angle on this. I really believe that this is an important issue for all of us, because I can't tell you how many people sit with me in my office and say, I'm just so scared of getting fat, and that's why I can't beat this eating disorder, or that's why I keep going back to my addiction, my substance addiction, right? It's a problem. So
well, and I can appreciate why someone would want to lose weight and be hopeful that they would lose weight. And I know that's not always what we talk about, but I consider myself like a partner on someone's food peace journey, and when someone is in a larger body and is feeling the oppression constantly, I work with people who are getting their picture taken out in public, like they're at the zoo or something. And I know
so much abuse,
horrible, violent acts every day just by walking around in their body that they live in, And so, I can appreciate why they want to be smaller. I don't think it's the solution, because I want our world to be more inclusive to them, but it's just they're not feeling it right now. And I think if I tell someone to stuff that down, then it's just going to make it harder on them, and it's going to provide more of a separation.
Yeah, they're going to feel alienated from this community that's supposedly for them, right?
Well, yeah, and I'm not going to get it. I'm not going to understand it on so many levels because I haven't lived it, but I want to listen. And so if I'm not open to that type of conversation, then I'm going to be alienating them. And I always think back. I got training in mental health counseling. That was like my master's program. And one of the things they taught us about children and play therapy and stuff like that is if you brought a child into the room and a room full of toys and you said, play with any of the toys in here, except for that dirty sock in the corner. You can't touch that. Well, they're going to want to go play with a dirty sock. So like, if I'm like, you can't talk about weight loss.
True, and practical parenting life too.
Yeah, exactly.
I can vouch for that.
No, so let's talk about it. Let's put it out there. Let's be open with it. I'm always congruent and honest with like, I don't want you to pursue weight loss. I accept you unconditionally, and tell me about your life. So women with PCOS, this is their life. They're constantly feeling the stress, like the physiological stress from oppression every single day. And so, I think it's important for us to listen to, and as providers, that's one of the best things I think we can do is make sure you set aside time to not just go over like the nutrition therapy for PCOS, but just this side of it. Like, let's talk about what it's like to live in your body. And it sounds silly, but I feel like that's really valuable.
So valuable. I agree.
Yeah. And actually using that word reminds me because my student that I was telling you about earlier, she was writing a blog post about how women with PCOS, their body is just as valuable. And there was something about that word that resonated so much with our Facebook group that people were like, I mean, we're just on Facebook talking, but like they were like crying basically because that's exactly, they feel invaluable because their body just feels so unfeminine and larger and they feel quote unquote gross, and so we need to remember that they need to be told that they're valuable. And part of that is just listening to their experience. Yeah.
Beautiful. Beautifully said. I love it. So you were talking about your bartering in your office because we were talking about step one right? So I always get on all these tangents. I have to make notes like, okay, where were we? But I love the tangents.
I'm glad you did. Yeah. So moving away from the dieting is step one. And honestly, we're talking about this and it takes a while for us to talk about it. So you can see how it takes a long time for someone with this.
That is not an easy step
to heal. Yeah. It's not something that happens overnight. But, when they can do that and then be sure that they're not dieting anymore, what I like to do as a dietitian is make sure they're eating enough. And so are they eating like a first meal? I hate to call it breakfast, but within the first couple hours of being awake, are they eating something? And then every 3 or 4 hours after that, at least checking in. And what's really common with women with PCOS because of their circadian rhythms being disrupted by their hormones, they're not hungry in the same way. And so they can really focus on work and get stuff done and not eat except for like once a day. And then that ends up having some massive cravings along with it. So it's really encouraging women to connect with their body more frequently. And so I often tell people to do that too. Just set a timer on your phone every 3 or 4 hours. Just check in. I'm not saying you have to eat. I just want you to do a barometer check. Just
and
eat
that's
anything.
An important thing for people to know is that you might be expecting this grand urge to eat or in the form of hunger, but maybe being open to the idea that that's not how you'll experience it, or that's not how your clients or patients will experience it too.
Yeah. So those are the first couple of steps. And then after that, I really have come to the conclusion that women with PCOS just need more protein than women without it. And that can look different for everybody. So I don't necessarily need to go into details because it really varies on the person. But I would just say, you probably just need more protein. And then another side of it is, there's like medicines like metformin that are often prescribed. And of course, I'm not a prescribing medical professional, and I'm also on a podcast. So, I can't discuss dosaging, but make sure if you're on metformin, talk to your doctor about the therapeutic dose.
Right. A
lot of times people are on too little because the person gave them the amount that you'd give someone with diabetes. And remember, their insulin levels are a lot higher. So they need to have more metformin.
You know what? I pretty much always see a very low dose of metformin with my PCOS people. So that's an important thing to keep in mind and maybe bring up with your doctor.
Yes. Yeah. I mean, we couldn't tell them to change it.
Oh, of course not. No.
The technical therapeutic dose that I'm currently seeing in research is 1,500 to 2,000 milligrams a day.
And 500 is typically what they do. Yeah.
Yeah. 500 or 1,000 is more normal.
Yeah.
But there's another thing that people can look into that I encourage, and I encourage this before any nutrition therapy, is like, move away from the dieting and the pursuit of weight loss. And then I talk to them about making sure their medications and they're getting enough of that. And then if they would be interested in trying a supplement, one that I really like right now is inositol. And earlier we were talking about those secondary messengers that were defective or something's going on with them. And inositol is one of those secondary messengers. And if a woman with PCOS supplements their body with it, and there's different types, and of course, I think like the supplement world, I know I'm jaded, but I feel like they prey on vulnerability. So there's a lot of really crappy ones out there, but ovasitol is one that has this type of secondary messenger in the right ratio that research is currently promoting. And unfortunately, it's the only one, which I hate because I love giving people options. But, looking into those things before you do anything, before you cut out carbohydrates or something super unnecessary, give your body some time with these 4 things for a couple months and revisit it, because I have a feeling like once your body actually has like lower insulin levels, you're going to feel like the craving to actually move, and you're going to start sleeping better, and your cravings are going to be different. Like, it's amazing and mind blowing how like just those things right there help so many people.
Well, and just the sleep alone, I'm such a wimp about not sleeping enough. So I feel for people who chronically can't.
Seriously, amen.
Oh, I'm such a wimp.
I mean, that's why I don't have more kids, because I cannot handle the sleep deprivation. That's the only thing.
Oh, that was so rough. I'm kind of getting through it at this point, and I'm like, oh, I feel human again.
Yes. So they, some people with PCOS that like are newly diagnosed in their 30s, they have never really had good sleep. And then they get a CPAP, or they, get a sleep study done, and they found out they have sleep apnea, and they get this special breathing device at night, and they actually wake up refreshed, and they're like, this is not fair. Everyone's been feeling this way the whole time, and I didn't know this is like normal. And so, yeah, I mean, if you're always tired, looking to see if you have PCOS or have a sleep disorder.
And, if you're always tired, life is hard. Like, everything is hard.
I feel like theirs is even worse. It's like this, they never get to that REM level deep enough to get sleep because they're constantly waking up.
That is so important. Yeah. That's so foundational.
I think it's like 75% of women with PCOS have a sleep disorder. I think that's what I read recently. So that's a lot.
Fascinating. And that could be, a cue that you should get other things looked into. With your health.
Exactly. Well, and if someone's listening with PCOS and they got, like 10 years ago, they got a sleep study done and they didn't have it, I would say get it again, especially if you notice like more cravings or your energy levels are dipping or your mood seems worse, because that sleep deprivation can be behind the development of that, just like that snowball effect that causes more inflammation with this PCOS and makes all those other things more out of whack.
Okay, I have sort of a out there question for you. If you have no idea, or if you haven't come across anything in the research, no problem. But I'm just curious, what does menopause look like with someone who's had PCOS throughout their fertile years? Is it the same? Do they still struggle post-menopause with some similar hormonal issues? I mean, anyone can struggle with hormonal issues in menopause, so.
Right, exactly. And so I know a lot of women will tell me, well, my doctor told me since I've already gone through menopause, I don't need to treat it anymore, which I don't agree with that. Because there's still, remember, it starts in the hypothalamus, which that's a part of your mood and your sleep. It's not just ovulation.
There's more hormones than just reproductive hormones in your body.
Yes, exactly. Vitamin D is a hormone.
Right.
So, it can still be a part of a woman's life, but a really good but is that usually the symptoms are not as detrimental.
Okay.
Like people usually have less, it feels easier for the first time once the menopause is over. So there's definitely still some side effects, but especially the androgen type, or the part that involves androgens or those sex hormones, the side effects they get from that end up not being as debilitating or as annoying to them.
So look forward to menopause then.
Yeah, that's what so many women tell me. They're like, I can't believe it. I'm like, I know, I'm dreading it.
Yeah.
It's not for me. So, but I'm like, I maybe look forward to it. And honestly, a lot of women do feel hopeful. They're like, I'm excited for that, And, a lot of women with PCOS end up, when they're pregnant, they say that's when they felt the best. And it's because
I've heard that too.
The placenta takes over. Yeah, the placenta takes over. And so the hormones are regulated by something else. And it's kind of a respite. So I wonder if menopause is similar in that way.
Fascinating. Okay, so I think you did a really good job of kind of walking us through some of those steps, that roadmap on your website. Anything else that we've missed, or did we kind of hit on all of them?
I think we did, but the take-home message, I feel like, is if you have PCOS and you've been told you can't do intuitive eating or you have to diet, just know that that's not true. You don't have to torture yourself with a diet. You don't have to be always thinking about food, especially those of you who are at like diet rock bottom or trying to move through eating disorder recovery, or maybe you've been in recovery for a long time and you get this diagnosis and this just throws you for a loop. You don't have to have that relationship with food that is super, like, I guess what we clinicians would call pathological. It doesn't have to be like that. And you can make peace with food too. There's just a different language you need to learn in order to make that work.
That's so hopeful. Because
I hope so. That's my intent,
Yeah, it can feel like, okay, I've gone through this journey of making peace with food and I've really made some improvements, and then here I get slapped with this diagnosis and now I have to go back to dieting for the sake of my health, right? That's sort of how a lot of people experience this, and it just can get so confusing. Is there anything else in terms of what you feel like people come across that's really confusing that you want to dispel? Like any common myths or frequently asked questions about PCOS that we haven't hit on yet?
One of them that we sort of touched on, but I think it'd be important to repeat, is that some women think they caused it. So no woman causes their PCOS. It's genetic and environmental, so it's not anything that they had any control over. And so just know that, like, that like cloak of shame and blame, like, take it off. It's not yours. It just doesn't belong to you.
I just thought of another element that we should have hit on when we were talking about the life of a woman with PCOS, kind of painting that picture. And this is a really big deal for many women, not every woman, but the fact that you can really struggle with fertility as a result of this condition, and the shame alone with just infertility as a diagnosis can be really, really difficult cross to bear. So like, this is just, you can just see how all of these things come together: the infertility, the weight cycling, potentially the feeling like you're constantly failing, never living up to your own expectations, plus maybe not being able to become a mother if that's what you want to do. And all of that together is just such a recipe for mental health struggles and for really just having a hard time in life, I
know. I can't believe we didn't talk about infertility.
I feel
probably
so dumb
like
that I did that. It's like, hello, that's the biggest part of one of the biggest things.
Right. I know it's the number one cause of infertility, and it's probably a mental block. I had my own struggles with infertility, so I bet my psyche was like, nah, don't go talk about that today. But it's one of the big things that I feel like, unfortunately, PCOS with its focus on weight has hurt so many women, because if a woman does do all those typical recommendations, it's not fixing, it's not getting to where PCOS starts. So it's not really helping their egg quality and ovulation long term. It may short term, that 6-week thing, or 12-week duration studies that people look at, which for some people, if they're doing IVF retrieval, that's all they need. I get that, you don't mess with maternal desire. We will do anything to have babies, but it really is awful that reproductive endocrinologist, I'm talking to you, that you really keep women with PCOS from proper infertility medication because of their weight. I think that is just, it breaks my heart that I hear that all the time. And so yeah, I mean, it's another reason why their body's not working. So it's another, like you said, cross to bear. And we really, when it comes down to it, for women with PCOS and those of us who are wanting to walk with them, we really need to help advocate for better care, for less stigma with it. And I hate it because it's like they have to advocate for themselves, but that's really the only way they're getting the care that they need. And so we providers need to do a better job of helping them with that.
This is just such a swirl of so many issues, right? There's,
yes.
I mean, it's like there's social justice issues weaved in here. There's kind of a lack of adequate research weaved in here. We're just sort of guessing sometimes in our recommendations. There's not dieting as a concern that can come in. There's body image. There's fertility. There's general health and well-being, mental health and well-being. It's fascinating. This is a really fascinating intersection of so many different worlds. And, if I would say something sort of in conclusion or closing would be, I think that we underestimate how much a person can struggle when every single aspect of their body is just not feeling right. And I just wouldn't want anyone to feel ashamed if they need to get, a therapist on board, or they need to go, work with someone one-on-one to help figure out their nutrition journey through this, and seek help, because there's so many things that are weighing on you when you're going through this, and you really might need somebody to talk to, because this is very complicated and very confusing as well. I don't know if I said that very eloquently, but I'm just imagining just so many vectors sort of like weighing people down who struggle in this way. And I think, we need to not underestimate when someone tells you I have PCOS. We need to, our red flags of, okay, how's your mental health? How are you eating? What's your relationship with food like? How are you exercising? We need to ask these questions, because it's very likely that someone is struggling very deeply because of all these vectors, I guess is what I'm trying to say.
Yeah, and someone, actually the student that's working with me, she pointed out something really interesting that I think you and your listeners would appreciate. If you go on Google and you type in PCOS and you know how Google fills in some of the rest for as popular searches, the number one thing that always follows when she does that is support. And I think women with PCOS are looking for support and they're not getting it. And I think it's exactly what you were talking about. So if we're just looking at the surface, and again, like the primary treatment is weight loss, like that is keeping people from really getting to the core of what women are actually experiencing when they're walking this earth with PCOS. And so we need to really actually support. So
yeah, that's super important. And so that leads me right into what I wanted you to share with my listeners. You've already shared your website that you have that's specific to PCOS. So it's PCOSandFoodPeace.com. Tell us about resources for your resources or other resources that you're aware of for women with PCOS.
So along with that roadmap, I have put together a Facebook group. It's PCOS and Food Peace. If you just Google that, you'll find it on Facebook. And I'm the only one in the group that doesn't have PCOS. So it's just for women with PCOS and me. And, it's really been amazing to see the community really come together and provide that support for each other and advocate for each other. And especially, because it's a place where people can talk about the nuance of like, I really wish I could lose weight, but I'm not going to pursue it for right now. That's what this community is for. And so, I would say if someone's listening and has
people are looking
it's the support.
For.
Yeah, that's
great.
That's why I love that my intern pointed that out, because I'm like, oh my gosh, I could totally do that. I would love to do that. So, and really honestly, I'm just really there every once in a while. And, and so it's people that have really, I don't know, connected. And so once a week, I do a Facebook Live in there and talk about some topics that have come up, and we share resources, and that's been really fun. And around the corner, in September, I'll be launching a course for women who
So this
are
will be
making
released
peace
in
with food.
September. So yeah.
Okay.
So tell me
Cool.
when that's coming. When are you launching your course?
My course will be launched September 19th. And so it's the exact steps that I take people through one-on-one. It's a step-by-step guide to food peace with PCOS. And so it's the how, like how do you move away from the scale? How do you say no to dieting? And how do you know how much protein to eat?
Yeah, like all that sounds good, but how do you really do it?
Yes, how do you actually do it? And so, what I found is, I'm a primary caregiver at home. I'm this mom that has doing most of the caregiving, and I have a private practice, but I can only see so many clients in a day. And I was getting more clients coming in than I could really meet with, and that hurts. I want to help everybody. So I basically just stopped seeing very many people for the last few months, and I've been putting this course together. So I'm really excited to actually put it out there to reach more people. And so it'll be more affordable, and it'll just be a way for everyone to get the information they've been requesting. And a part of that, of course, is support along the way. There'll be a private Facebook group and stuff like that where we can provide even more support. And so it'll be released, like I said, September 19th. And if a person goes to that PCOSandfoodpeace.com website, they will get I'll get their email address, and when you get that download of that free roadmap, and so then you'll know when it's going to be released. So you can stay on top of that.
On September 19th, would you access it through that website?
Yep, you can do that too.
Cool.
And I mean, and the thing about it is you don't have to buy the course. You can also join the Facebook group that we were talking about and have the free roadmap. Like you can also just hang out,
and they can listen to your wonderful podcast too.
Oh yeah. How did I forget about that? Yeah. I also have a podcast. So the top page and I have gotten to know each other as fellow podcasters, but yeah, my podcast is Love Food. And I really, want to help all men and women or anyone walking through life with a complicated relationship with food. And PCOS sometimes comes up and sometimes it doesn't, but it's basically like a Dear Abby type of show. People write a letter to food and food writes back, and me and sometimes the guests try to help out and give some experiments and some possible solutions. So check that out. Again, that's Love Food. So Love Food, and then also the PCOSandfoodpeace.com is the best way to get a hold of me these days.
Great. Thanks for sharing all of that. I
Thank you, Paige.
Can only imagine how much of a breath of fresh air that'll be for people who have been searching for resources and just have continually felt so disappointed and discouraged and confused. So that's really important stuff. I'm glad you're doing it.
Well, thanks. And honestly, it feels like a privilege to do it. So I'm always appreciative when they let me just listen and hear their experiences.
Yeah. And that was something that stood out to me that you said today is just, I loved it when you said, I'm willing to listen, or you said something along those lines. And I think this world needs more of that. And you're such a good example of someone who has listened throughout the years to women's stories and kind of said, there's got to be a different way. Let me dig in. Let me learn. And, look at what it's produced. Something that I'm hoping will just touch so many people and help them. So I think listening is a really important thing in life. And I try to do more of it rather than too much talking. But here I am talking too much.
Well, I am an extrovert too. So it's I will talk a lot. But I think, if we could just listen, I think we could really help people just feel more comfortable in their skin and also healthier at the same time.
For sure. Oh, this has been so great, Julie. I'm so glad we got to talk about this. And thanks again for making a second appearance on the podcast. I appreciate it.
All right. Well, thank you for having me. Take care.
Well, I sincerely hope you've enjoyed this conversation. If you haven't already, please go ahead and leave a review on iTunes. Thanks again so much for listening, and we'll see you soon for another episode.